happen notice, I have a device manual. I may have those ISO references that are referred to. Excuse me. The actual work order referenced and hashed, the service guide, and importantly, we're able to capture digital information as well. So here, this is a future state for on-site clinical engineers. Augmented reality with menus, abbreviated, focused on the things I should be doing. In this case, an infusion pump where, yes, there's a series of things I'm doing around routine maintenance and repair, but let's say I had canvassed my inventory for all devices across, not just infusion pumps, but all devices across that have some operating system underneath. I want to know all those, and I want to get on patching that vulnerability. Here you would capture that timestamp of work done on the software, and now I've captured that image. We'd be able to take that image as well and associate it with this attestation. So the attestation richly understood, the service record richly understood for a piece of equipment, medical device, is comprehensive to the actual notice, the actor, their certifications, their association, and the underlying attestations and artifacts. We believe that is the future of service records around medical devices and equipment right through decommissioning. And this is robust enough, and we've built our platform that actually we could take this across sectors. This could be used for asset integrity in oil and gas, subsea infrastructure. This could be used around decommissioning. It might be used in aviation, aviation maintenance or management of other critical infrastructure. So it's ambitious, but we have built the underlying back end to be protocol agnostic as blockchain evolves. And we've also enabled it as an API, so existing systems, to the extent they are going to be in place, can reference back, or we can push information to. Likewise, the incorporation of an alert system that's comprehensive and representative. The curation of that alert system would not be by us. The ability to accommodate that and bring it to a common dashboard is our vision. Down the road, incident reporting clearly is something you'd want to be able to accommodate as well. This is what I call outside in, bringing known issues that have been raised to the level of alerts and formally considered to be notices and recalls. Inside out would be able to return that cycle and improve that cycle and have it work much more rapidly. That would be long-term vision, but this is representative of where we're going. So I thank you for your time and welcome your questions.
Experience from other domains and also from the industry. So welcome to Susan Ramanut from Spiritus.
Well, I've got two challenges. One, you may not recognize my accent. I may need to speak slowly and clearly. I'm delighted to be here, delighted to be in Scotland, actually resident now in Scotland, partly by benefit of a Scottish Government grant to our company. We have a team of 6 people in Edinburgh that have been building out our platform. We have as well a grant through the Data Lab that has us working with NSS and Edinburgh Napier's Bill Buchanan and a PhD student on some of the cybersecurity aspects of our offering. I'm pleased to say as well that I just got back from Ottawa where I had an opportunity to meet with the executive director and his team at the Medical Device Bureau. And he confirmed what I had suspected looking from the United States here to Scotland and certainly hearing broadly in the UK. Your problems are common problems. And we have felt that the initiatives, many of which we've heard here today, this confluence of challenges and the threads and focus of various working groups really come together nicely around our ability to help bring some clarity and opportunity. I'll start also by saying that I'm on a brief note, and I've been chartered with helping to explain blockchain to you. So how many people have heard of blockchain? And probably only in the last 6 months. How about Bitcoin? Cryptocurrencies, Bitcoin, that craziness that's going on. Okay, we've distilled from that some design principles and are trying to deploy that technology and utilize it in a regulated setting. I come from finance. I was a risk manager. I care about governance. I'm now applying what I've learned in finance around safety, security, and compliance. So the first thing I'll start you with is where Sarah certainly is, and I am as well, is the idea of the unique device identifier being something that globally, whether regulators or manufacturers, providers as well, are interested in. And certainly the initiatives here in Scotland, whether it's looking at GS1 and applications of their standards, more broadly the scan for safety, the need to get our RFID tags or some kind of passive or active tagging, whatever system you're using to track, Wi-Fi, Bluetooth, whatever it is, that's a great start. But that's just telling you where a device or piece of equipment is. It doesn't answer the question of whether it's safe and in good order. And that's really our concern. To what extent do I know and understand that a bed hoist or mattress, an implantable, an infusion pump, which is unfortunately quite complex, involves many underlying components, including software, implants, and then the glucometers with the insulin pumps that now are increasingly connected to one another, software enabled, maybe algorithmically controlling one another. This is the face of innovation addressing many of these disease processes, the introduction of software, but with it come vulnerabilities. So that question of what's safe and good order is a pretty interesting one. The Chief Information Security Officer of the Mayo Clinic shared with regulators last summer, as well as industry actors, that he has over 25,000 connected devices at the Mayo Clinic. 25,000. Here's the number that gives me pause. 6,000 unique makes, models, and versions. 6,000. Now, connected devices really only represent 15 to 20% of the overall inventory. There's an average of 40 devices per bed in a hospital, about 15 to 20% connected. Yet underneath that, uniques, makes, models, and versions, and some 10 to 20 operating systems underneath those, and then devices that talk to one another or are part of families of devices. Just in the software area, and we heard more of that. I certainly heard it from the regulator in Canada last week. Software in and of itself is a major challenge, and yet it's enabling and will enable the digital health strategy that is characteristic not only of Scotland, but is true in Canada and the United States as well. So this intersection comes up against what we also know, that not only are systems siloed and organizations siloed and reporting siloed, but the complexity and the need to move quickly is growing. So let me step you into distributed ledger technology or blockchain. The core principles are really that you're relying on cryptographic proofs. Two parties agree a transaction. They exchange cryptographic proofs by way of public and private keys. You rely on a network to validate the transaction. You share the transaction across a network. That network examines the transaction and performs a mathematical proof. That proof's so complex in the world of Bitcoin that to beat the system and get ahead of everyone else and potentially gather and collect the monies that are in the system, you would have to employ hardware, software, and electricity far in excess of the difficulty of performing the transaction. So it's a race. It's a race between how complex is the cryptographic mathematical transaction and can I muster the hardware, software, and electricity to beat it. So core principles, cryptographic sharing between two parties of information, agreement, a transaction is good, a consensus among the other parties and the system that it's good, and then an append-only database that's shared among parties. Well, this breaks down quickly when you move into a regulated sector. This breaks down quickly when you have private information or you have peer-to-peer exchange of information. So what are the design principles that are of value in a permissioned situation that allow us to get the benefits of transparency and validity and traceability around transactions, but still have privacy-preserving aspects to them. And that's what the permission ledger is about. There are initiatives not only in finance, but in healthcare, supply chain more broadly, government areas such as voting and tax submissions and the like. Across the globe, folks are looking at this technology in a permission sense, a depend-only system of record that's shared among parties, a consensus. In this case, not distributed widely across a whole lot of minors, but an agreed group, 7 or 11 or 15 parties, of whom the majority must agree the transaction is valid and across whom the records are shared. Well, what's the value of that in the setting that I was just describing? How can I ensure that the right rules and privacy are in place? What we've taken a look at is the opportunity to take that operating life or service record for a medical device and see if we might bring the parties together, not only within a board or a hospital, but including and encompassing the possibility that a third-party firm that is certified, either representing the manufacturer directly or a distributor or a certified engineering agency is coming in and performing some maintenance and repair or taking a corrective action based on a field safety alert, a recall, or a notice. That inspection, testing, and certification activities likewise are being performed subject to audit that regulators can look at and examine. Right through decommissioning, ensuring, yes, somebody has attested that patient data has removed, that the equipment is in good order, that the associated service and repairs have been performed, or importantly, that decontamination activities have been performed, right through disposal and recycling. We envision this as really coming together and being a layer or a source of data and reference that can step out and accommodate existing quality management systems or equipment management systems, really just be that reference point back. If a field service engineer is performing work, that work can be recorded back to the distributed ledger, clinical workflow systems, quality management systems. And on the back side, libraries. Libraries that have the reference notices, those field safety alerts, the corrective actions that have come from manufacturers, standards, down to particular ISO standards as they may exist, IEC, specific regs, internal controls, whatever those might be, there's an opportunity to automate that and record that as a construct, as part of the transaction. So what does this look like? What have we built, and what is it that we're trialing and testing? From the point of view of perhaps an equipment coordinator, head of clinical engineering or medical physics, looking across boards, it well may be they're using an existing system and their existing equipment management system, and again, we can provide that data in and that validation. We'll see what that looks like. But we envision a dashboard that allows you to look across in a risk-based sense and say, what's in my docket? What should I be working on? What do I care about? So here I've illustrated infusion pumps, ventilators, hoists, glucose monitors, infusion pumps, defibrillators. What might be those high-order things I'm concerned with? And in a dashboard sense, where do things stand? To the extent you would have an NSA-OG, safety alert system, it can be part of that right side action items. Here we're bringing in a field safety notice from Becton Dickinson related to a recall. You'll notice down in the lower right, I have the notice. We'll be able to pull that up, the actual notice. But ideally, not only here, but globally, you're going to standardize reporting. Yes, that detail matters, but there ought to be some standard data schema that can allow you to reference and search those relevant field standard safety notices and the like. That would be a hopeful thing that we would want to work with parties across borders and across sectors with. Then I have the idea of going and looking at my specific inventory associated with that device. So now we have the unique device identifier. Underneath that, device identifiers that may be germane to product and more specific to a board. Here I am now looking at all of the facilities within my purview. and understanding how many units of that particular device that's under recall are located at each facility. I come down still further and I'm able to see in which unit. Now I can do my risk-based assessment. Where should I prioritize? I have that larger view of what my teams are doing and third parties are doing around equipment, but in a resource-constrained environment, I'm able to actually look and hone in, and I want to look at that intensive care unit first. And when I look at that intensive care unit, I see there are 9 units. Now this is a representation from our demo. You would actually scroll down, and if I scroll down, I'm able to see really the line, the history, going backward and forward, readily scrolling backward and forward in time, and able to see chain of custody moves, a move from the stock room to a ward, or from a ward to an operating theater. Inspection and testing activity, CAPAs, M&R activity. You can look at this visually, vertically. These are 9 devices under recall around that specific recall. I can look vertically, and once these are lined up, I'll be able to see that, in fact, there are some exceptions. That some maintenance or repair activity hasn't occurred, or inspection and testing hasn't occurred. If I want to scroll down now and look at this specific recall, here's what ends up being hashed, if you will, that's the term, hashed to the blockchain shared registry. And it's a combination of information. We start with the notice up at the top, the specific asset. This is common all the way across. We've identified that device, that model. We're referencing the specific notice, the alert or recall, and the actor. In this case, a third-party clinical engineer who is certified to perform activities. That's represented in that profile. Their firm as an organization being contracted with the board. Likewise, being acknowledged and certified and attested to this record. So what does the attestation around the work order associated with this recall for that specific device look like? It looks something like this. I have that engineer represented, but somebody within the organization in an information governance, clinical engineering sense has attested that this underlying work has been done. And these are the artifacts. I've got